Welcome to CARE Samvaad with me, Mirchi Hemant, and today I have Dr. Vikranth with me, and we are talking about one of the most important body parts, that is the kidney. Sir, these days, every time I see a newspaper or AI, ChatGPT, Google, they keep saying CKD, chronic kidney disease. Sir, in simple terms, please tell me what is this chronic kidney disease?
So basically, chronic kidney disease means that the disease is there for quite a period of time.
Okay.
So beyond 3 months, by definition, if you look at the textbook definition, if it is beyond 3 months, if you have a disease beyond 3 months, we call it as chronic kidney disease. So usually, sometimes say you have malaria, you have dengue, or you have dehydration, loose motion dehydration, the kidneys might get affected. That we call it as acute kidney disease. So those things are different. But somebody who is chronic, means who has disease for last 3 months, we call it as chronic kidney disease, be it because of diabetes, hypertension, stone, or somebody who is taking long-standing painkillers. So they all are the people who develop chronic kidney disease.
And sir, now that you said, the painkillers or diabetes or all these factors, but please tell me the risk factors involved with chronic kidney disease?
Yeah. So risks are basically if somebody is a smoker, alcoholic, diabetes, hypertension, high fat diet, improper lifestyle, all painkillers on and off. People are taking painkillers on and off nowadays. So all these are the risk factors. These are the people who can get a chronic kidney disease.
But sir, what I understand is kidney is somewhere happily hidden in the body, inside
the body. Yeah.
So how do we get the warning signs?
Yeah. So another myth is many people think that the back pain is a kidney pain and all. Usually back pain is not a kidney pain. It's a myth basically. Kidneys are hidden just in the front, just below the ribs here in the front portion. So what are the warning signs? Yeah, it's hidden. So there are no telltale signs that you get like this, you have a kidney disease. Usually, so that's why this disease is picked up only on screening. So that's why we as healthcare doctors or healthcare providers like hospitals like CARE and all, so we do screening tests. So we have wellness clinics, screening tests and all, so as to pick up these hidden diseases like chronic kidney disease or some diabetes, uric acid. All these things are not shown outside. So that's why these screening tests are very, very important and very pertinent for chronic kidney disease. Because for heart disease, a patient will get chest pain, he goes to the hospital, ECG is taken, and any pains, then the bone pains or anything, uric acid, they will know. But for kidney, there is nothing like that. In advanced stages, in very, very advanced renal failure where, body is not able to cope up, then people will develop breathlessness, then anemia, edema, all these things will develop. But by that time, it is too late, and then only treatment is dialysis and, other treatment, of which patient doesn't like. Yeah.
So if a patient comes to you,
yes,
and then you send them to screening, we get it. But at home or in their general daily life,
yeah,
how do we know that there is a problem with regards to kidney?
Yeah. So certain subtle signs like urine, if you take, because you all know that urine is formed by the kidneys. So any urinary abnormalities, we call it as frothing of urine. Suppose somebody passes urine and there is foamy urine that is forming, or bubbles kind of things that are forming, that are formed in the commode or wherever they are urinating. That is called as frothing of urine. So if any foaming or frothing of urine is there, that is one of the earliest sign of kidney disease. So one should not ignore this abnormal passage of urine or foamy urine or frothy urine. They should not ignore it. They should consult a doctor. Then other things is, normally we pass white to yellow color urine, all of us. So if we are passing red color urine or blood in the urine, that is again an abnormality that needs medical attention. So that has to be immediately, you should not ignore that they should come and seek medical attention, do an ultrasound, do urine and consult the doctor, then evaluation can be done. So frothing of urine, urinary red color in the urine, or any difficulty in passing urine, are usually we pass about one time, or maximum somebody sleeps and the next day morning only they pass it. Somebody is passing urine more frequently in the night also is something related, is something happening to the kidneys. That also we should look at. Then the other things are leg swelling. Leg swelling, there can be many reasons. One of the reasons is kidney. Heart failure also can have leg swelling, liver diseases. So many diseases are there, but again, leg swelling one should not ignore. We have to evaluate the cause, be it because of kidney disease or anything like that. The other things are young hypertensives. A 30-year-old, 40-year-old, suppose somebody is a software professional who goes for a pre-employment checkup, say 26 years or 28. They keep even if they change a job also, they will go for employment checkup. That's a very good thing that they are doing. So in the pre-employment checkup, most of the time they see 140, 150, 160. They should not ignore that, because for a young person, that BP is high. So there's something going on there. They should also seek a medical attention, because usually young hypertensives, the reason is not heart, the reason is kidney.
Yeah.
Hypertension can be because of heart disease or can be because of kidney disease. But kidney disease, hypertension is treatable, and if left unnoticed, that can cause kidney damage, which is more dangerous.
Yeah.
So that's why young hypertensives, they should be very, very careful regarding this hypertension. Yeah.
Sir, you said why screening is important. You
Yes,
told me that.
yes.
However, my point is, when you say it turns into dangerous, so when does the chronic kidney disease change into kidney failure?
So what happens is, say for example, just now I was telling about a software professional pre-employment checkup, 140, 90, 150, 90. The person who is there, maybe a healthcare technician or somebody, whoever has done, sir, your BP is little high. So from there, he should not ignore it, and if he goes for a proper health checkup, again screening further in a hospital-based setting, we will come to know whether he has a heart issue or a kidney issue. If you ignore these points now, say he's busy with his job or whatever, assignments and all, he ignores this, and when his blood pressure is high, someday he will develop giddiness or some headache or sometime, then that time when he check the blood pressure 160, 90, then they will say you go see a doctor. Or other problem is they develop eyesight issues also because of high blood pressure. They develop eyesight issues. So that time, if they seek medical attention, by that time his creatinine would have gone up. But that is the time he has already developed a chronic kidney disease. And this, if ignored again, will eventually develop a kidney failure. In that kidney failure, they develop this because of high blood pressure, eyesight issues, heart issues, then breathlessness, edema will be there, leg swelling, so generalized swelling of the body also can come. So all these things will keep on adding one problem or the other. So that's where they are going into kidney failure situation.
So what are the available options, sir, medically at that stage?
At the kidney failure stage.
Yes.
So if one develops, if we pick up before kidney failure, we have treatment options like control of blood pressure, whatever associated factors are there, we'll control all of them. Lifestyle changes, dietary changes and all we'll advise. But once we cross this stage, then only options left is kidney failure is there. That means kidneys are not functioning optimally, 100% they are not functioning. Then they have to go for replacement. So the replacement options we have is dialysis. Dialysis is one of the common replacement modality. Correct. Everyone might have heard, you might have heard dialysis. So that is a common modality where, when somebody has a kidney failure, they go on to dialysis stage. So in the dialysis also, we have got two types of dialysis. Hemodialysis, that is through blood. Blood is gone into the machine, purified and comes back. That is hemodialysis. The other option is peritoneal dialysis. Peritoneal dialysis is the one where we keep a small tube in the stomach and we put fluid into the stomach. Saline kind of fluid is there, that is called as peritoneal fluid, that we put it in the stomach, and then after 4-5 hours it will absorb all the waste and we drain it.
Correct.
This is blood based, and the other one is a water based. What I'm talking of peritoneal is water based dialysis. Then the other and the best option is kidney transplantation.
Correct.
These are the three modalities patient can choose. So sometimes patient should not feel unhappy or bad about it, or he should not think that this is the end of the life. End stage kidney disease is not end of life. After end stage kidney disease or end stage kidney failure, we have treatment options, like as we just discussed, dialysis, peritoneal dialysis, and kidney transplantation. Kidney transplantation gives a better result or better quality of life to the patient, because he doesn't have to do these dialysis on an alternate day basis or a daily basis. So he can be just home like any one of us. He can continue with his job, his family life, everything like a common man what he does, except for that he has to take the medications regularly. Yeah. Otherwise he can do like any other person, any one of us.
Sir, you told me about why dialysis or the kinds of dialysis.
Yes.
All this I totally understand. But my point is, how does the doctor decide which type of dialysis is important for that patient?
Yeah, usually hemodialysis is being done, that is blood-based dialysis. For any patient, we can do hemodialysis. Peritoneal dialysis, certain specific group of patients we advise, like heart failure. Because somebody has a heart failure means they'll have low blood pressure, heart is not pumping well. So for them, if I do a hemodialysis, that time he may crash or he may have blood pressure low on dialysis, he may have a heart attack on dialysis. So these are the subset of patients where we prefer going for peritoneal dialysis. Otherwise, majority of the time, both are equal, both are complementary to each other. Both are almost same. It's like Maruti and Hyundai both are almost same. So it's like that. So both peritoneal and hemo are good. And peritoneal we prefer if they have lot of comorbid illness. Somebody cannot come to the hospital.
So they say kidney transplant.
Yes.
Please tell what is kidney transplant and when do you suggest that?
Yeah. So kidney transplant is one of the options of end-stage kidney failure. One of the best options because the quality of life is better. So when we say kidney transplant, it means that a family has to donate the kidney. Again, there is a myth that who has to donate and things like that. So according to the government, Indian government, so family members only have to donate. That is mandatory. So once the family member donates, both the kidneys inside the body are kept like that. We don't remove any of the patient's kidney. The new kidney from the donor is taken and put on the right side of the body, right side below the right kidney. And that is attached to the bladder. Urine tube is attached to the urinary bladder. So this is transplantation. The recipient will have 3 kidneys, his own 2 kidneys and 1 more kidney down in the right iliac fossa. So he'll be moving around with 3 kidneys. The upper 2 kidneys are non-functional. The lower 1 kidney which is kept is a transplanted kidney, or we call it as a grafted kidney. That is the 3rd kidney which is functional. So this we advise once they are end stage renal failure, they are 3 months on dialysis and they have no chance of recovery whatsoever, then we advise them for transplantation. Usually the Jeevan program is there. They will do registration mandatory after 3 months after dialysis.
Sir, on one side you say live donor.
Yes.
On the other side you say
Jeevan.
No, sir, the cadaveric transplant.
Yes.
Sir,
what is this? So basically, in the transplant, we have 2 types. Donor, live donor. Live donor is the one which family has to donate. Family means husband, wife, father, mother, brother, sister, grandparents. So all these come, close relatives, So these comes as a family. So that way, if they donate, the blood group has to match. Mandatory for any transplantation is blood group has to match. Like how we take blood transfusions, like A positive person will take A positive. Similarly, here also the blood group has to match. That is mandatory. So once the blood group match, if the family is willing to give, we do the cross match, and various other tests are also there, HLA and routine tests, matching and then cross match. Then health checkup also we'll do for the donor, whether he's fit to donate or not. That also lies on our this thing on it. So if they are fit, then we take the kidney. So that is called as live transplant after fitness and everything is established. That is a live transplant. Cadaver means cadaver or a brain dead donor or cadaver, all these are the same, or a deceased donor, all this is the same terminology. So in that, what happens is there is a registry maintained by the government of Telangana that is called as Jeevan registry. Once somebody crosses 3 months of dialysis, we register them for the Jeevan program. In that, blood group is mentioned, a patient name, particulars, blood group. They also undergo fitness certification from the treating nephrologist. Once he's fit for transplant, we put them into the list for registration. So once registered, once we get, suppose A group is this, once we get a group donor, A group brain dead person, he will be called and we give that kidney to this person. That is called as a brain dead donation or a deceased donation.
But which is better, sir?
Live is better because live is elective. We know how the quality of the kidney, we see that before we do the matching, everything we do. In the cadaver, nothing much is possible. Like we call it, beggars can't be choosers. So it's like that. So we can't choose so many things. So whatever is available, we have to take it. Otherwise, next person will take it. If say somebody X is refusing, then it will go to Y. Y refuses Z, then A, like that. It will keep on going. So we also don't know, as doctors, we also don't know the quality of the kidney also. Sometimes they will be doing very good. Sometimes the creatinine may not improve. Urine, they may not pass urine after transplantation. Sometimes graft may not work at all also. So that's why if you compare these two, live versus cadaver, live is better as compared to cadaver.
Sir, also I'm sure there are a lot of technological advancements
Correct.
with regards to nephrology
Correct.
in the last decade, sir. How did this change the outcomes of the patients, sir?
Yeah, definitely, because the newer medications, just now we talked about a lot of side effects. So the newer medications which have come in the last decade have lessened these side effects. People started using lesser and lesser steroids. People have come out with new protocols of not using steroids also. So the cosmetic side effect, risk of obesity, risk of diabetes also has come down. People started using medications which decreases the risk of rejection, so that we don't have to use more medicines. So the injections have come in. So the injections can be given at the time of transplantation, so that the risk of rejection is lesser there. So these kind of things have many advances have come, so that the side effect profile of the medications have come down. Then again, screening tests, the cross match test, the screening test, the matching tests, also there are a lot of advancements in that, so that the better matching profile is being selected for the patient and better outcomes are being given to the patient. So benefit is given to the patient basically. Yeah.
So again, when you come back, I mean, what kind of promising research or innovations that are happening with regards to, say, dialysis or transplantations? How promising is that?
Yeah, see, now major research is going on, like artificial kidney. You also might have heard people are talking about artificial kidney. So people are doing a lot of research on that, but still it's in experimental level. It's not coming to the vogue of. It's not coming to vogue. So for patient use, still in the. So lot of effects like the artificial kidney is not able to sustain, because the moment the blood comes into any environment or any other than the body, it tends to clot.
Yes.
So artificial kidney is artificial. It's not it's attached to the body, but the blood comes into the contact with that, it tends to clot.
Correct.
So that's the major challenge scientists are facing. So once that is overcome, then how much functioning it can do, whether it can really, because the human kidney is very dynamic, and it senses many things, like you take more water, next hour you go for piss. You take less water, you don't go for urination at all. You go in hot sun, your body tries to conserve your water. So a lot of functions it will do without our knowledge. We just do our daily work, but inside it is doing so many things. Yeah. Similarly, such kind of things artificial kidney will not be able to do. Yeah. So those are the challenges the scientists are facing. So let us hope for the best. At least somewhere near dialysis, if it comes to, at least we can avoid dialysis and do something with that, with some modifications in that device, and hope for the best, so that it benefits majority of the patients who can't go for transplant, who has some other major issues, heart issues or liver issues. They can be at least on an artificial kidney. So,
sir, I mean, finally, if you can tell me, what role does preventive kidney care play in reducing the chronic kidney disease in India?
Yeah, so it's very important question, Hemant, because one need to understand that chronic kidney disease has a lot of impact on the person. Suppose somebody develops, X person develops, there's a lot of impact on him for his quality of life, for his mental health. Also, he might feel very depressed also, what disease I have got. And also an economic burden, because this disease eats away your economy, eats away your cost, and eats away the family's cost, and also the economy of the country and economy of the world. So it is a disease which is going to burn the pockets basically. So nobody wants such a disease. So best code for any disease that is to be prevented is a chronic kidney disease. Prevention is better than cure holds for chronic kidney disease, because of so many implications on the personal life, on the economic life, and mental life also. So mental health also impacts. If somebody gets a chronic kidney disease, who is a job seeker, who is a software engineer, or who is a doctor or an engineer, whatever. So nobody wants to get that disease, because it's a lifetime problem.
Yeah.
So a lot of mental health burden also is there, economic burden, mental health. So prevention is better than cure in such a disease. So that's why screening tests are very, very important. One should undergo screening. Don't neglect hypertension or diabetes or early signs like any urinary abnormalities should not be ignored. So these things, if somebody takes care of that, so then we can prevent chronic kidney disease. So we cannot cure it, but we can prevent the progression. Say he will go into end-stage renal disease in say 5 years or 6 years, we can prolong it to 10 years or 15 years. At least that quality of life we can give for 15 years. Say somebody who is at 35, if I can prolong his kidney disease by another 20-25 years, by the time he reaches 60 years, okay, if that time I do dialysis, he doesn't mind. So that's very, very important.
Yeah.
Otherwise, 35, if I do dialysis at 40 years, his quality of life is ruined.
Yeah.
His mental health is ruined. 40 years, nobody wants to get dialysis done. So many things are there. So that's very, very important. Yeah.
Sir, I have a bunch of rapid care questions, sir.
Sure,
I
sure.
want you to answer in a word, if possible, please.
Yes, yes.
First one kidney health tip everyone should follow daily.
Yeah, hydrate yourself well.
The most common myth about kidney disease you hear from patients.
Is it one kidney or two kidneys? It's always two kidneys.
One food you will always tell kidney patients to be cautious about.
Salt.
If you had to sum up kidney health in one line, what would it be?
Hydrate yourself well, so your kidneys are safe.
Hydrate yourself well. Well, thank you so much, doctor. I had a great time.
Thank you.
You told
thank
me
you.
everything that is to be about kidneys.
Thank
Now I'm more cautious about my kidney than my heart and brain.
Yes, yes.
Thank you so much, doctor.
Thank you very much.